Hello, I am Nelson Ramirez, Executive Director at Hispanic UMADAOP, a substance use prevention and treatment organization. As part of our Tree of Hope conversation, Hispanic UMADAOP will bring professionals in the areas of substance use disorder. I am here today with Dr. Christina Delos Reyes, Associate Professor, Department of Psychiatry at University Hospital. Welcome, Doctor.
Thank you.
Dr. Reyes has over 20 years of experience as an MD and specializes in the field of addiction psychiatry. Doctor, can you tell our audience about what work you do?
Sure. As an addiction psychiatrist, I spend my time seeing patients and treating them with medication-assisted treatment as well as other interventions. And I also do a lot of teaching and training of residents and fellows at university hospitals. And then I do some consulting on the side.
Wonderful. Your field of expertise is addiction psychiatry. Can you tell our audience what is addiction?
Basically, addiction is a chronic brain disease. And that basically means that once a person develops it, it is something that they're going to have to contend with basically lifelong. However, it is a disease that comes and goes. So there may be times when a person is doing better from the disease of addiction, and there may be times when a person is doing worse. Addiction affects the part of the brain that is involved in pleasure and is involved in decision making and judgment. And so sometimes when a person's brain is affected by addiction, you may see that they have out of control behavior.
So it impacts the brain. Many people don't understand that. Why is that some folks do not understand that concept?
I think it's because when we see somebody acting in a certain way, we might think, wow, they are deliberately choosing to do that behavior, and that they are, perhaps acting like a bad person. But what's actually happening is that the brain has been hijacked by the drugs that they're using or the alcohol that they're drinking. And they've actually lost control of their ability to behave in the way they normally would. So it may appear that they're acting on their own, but actually the addiction has taken over. And so sometimes that's hard to tell the difference between those two things.
Doctor, that sounds like a very complicated interactions. So how is addiction treated?
So addiction, in one sense, is a biological disease because the brain is affected, but it's more than just a biological disease. Some people like to think of it, including myself, as a biopsychosocial spiritual illness, which basically means that there are biological, psychological, social, and spiritual influences on the person. And so when I'm thinking about a treatment plan, I try to cover all those bases. So in terms of the biological, I try to offer a medication that might help the person with decreased cravings or might help the person to normalize their behavior. In terms of psychological, I try to get the person into the right kind of therapy or counseling. In terms of social, I work with the patient to connect to a sober support network like a 12-step program, Alcoholics Anonymous or Narcotics Anonymous. And then finally, on a spiritual sense, I do try to reconnect the person with their spiritual beliefs. Perhaps they attend a church or have some other sort of connection to a higher power. So yes, it is a complicated illness, and so it needs a broad kind of solution.
I like that concept of that broad solution because it brings many resources to that individual for their recovery. As we know, with nearly 600 overdose deaths in Cuyahoga County each year, people wonder, is recovery possible?
It absolutely is. I wouldn't be sitting here talking to you if I didn't think recovery was possible. One of the best things about my job is I get to see miracles happen every day. And so even though this is an extraordinarily difficult disease to have, I have seen the miracle of recovery multiple times in my patients, in the patients of my colleagues, in family members. So I've seen it happen. So recovery is absolutely possible. But again, you have to basically attack the disease from all those different angles that we were talking about earlier. And the more you emphasize all four of those things, I think the better the chance the person has to get well.
Would you consider an individual as failing if they have a relapse and require another session of treatment?
Actually, I wouldn't. I started to think about addiction as a medical disease as I was entering medical school, and it became clear to me that addiction is very much like having the disease of diabetes or having the disease of heart failure. So when a person has diabetes and for whatever reason their blood sugar goes out of whack, we don't call that person with diabetes a failure because their blood sugar is now abnormal. We say, oh, it looks like the disease has come back. We might need to have you come back into treatment so we can adjust things. For whatever reason, the way our society is, and there seems to be this thing that once you have the disease of addiction, if you're not sober 100% of the time for the rest of your life, somehow that's not good enough. When in fact, this is a chronic illness. It comes and it goes. It has episodes. So sometimes a person will do really well for 6 months to a year, and then sometimes they'll have a slip. They have to come back into treatment. It doesn't mean that they're a failure. It doesn't mean that treatment is a failure. It means that treatment has to be reinstated. Similar to the diabetic, you have to reinstate the treatment and then get that person stable again.
So that could be considered a barrier or a stigma. What other common barriers or stigmas do you see in treatment and recovery?
I think there's a few that I'd like to point out. The first barrier is misinformation. So not understanding that addiction is a brain disease, thinking that it is a moral issue or a social ill, that lends to the stigma. So that's one issue. I think not having enough of an infrastructure of treatment in the United States is another issue. So people can identify themselves and say, hey, I've got this disease of addiction. I want help now. They call up the phone and they're told, well, yeah, there's an 8-week waiting list. Imagine in this country if you had heart failure or cancer and you were told, well, there's a waiting list. We don't have waiting lists for many other illnesses. For addiction, for mental health, sometimes people wait a very long time, and sometimes it's too long, and then it becomes too late. And so I think that one of the other barriers is lack of access to what I like to call treatment on demand. Treatment on demand is when you say, I got this problem, I need help, you get the help that you need right then and there, just like you would for any other medical illness.
As we discuss these barriers and stigmas, are there ways to overcome them?
Definitely. Just being invited today for this kind of talk, I think, is one of the best ways to overcome it. Just bringing it out into the open, talking about it, realizing that it's a real thing, that it's affecting everybody in the community, advocating with our legislators and with our funders to say, we need help here. I mean, one of the things about the pandemic is that I've read, and certainly it makes sense to me, that we're actually dealing with an epidemic inside a pandemic. So you've got multiple layers of issues going on. So yes, I know we're sort of trying to fight the pandemic, but at the same time, I think we have to, as treatment providers, say, yeah, and our patients also still need the help, and we're still here. And the opiate epidemic isn't over just because of COVID. We're still here, and we need the support.
Wow, doctors, you have covered a lot in a short period of time. In conclusion, what else would you like to share with our audience?
I guess I'd like to end by saying that addiction is a disease. Addiction is treatable. Recovery is possible. And you need to reach out and ask for the help that you need. It's there in organizations like Casa Alma, Hispanic UMADAOP, and others around the county.
Well, thank you so much, Doctor.
Yeah, my pleasure.
We have been visiting with Dr. Delos Reyes, Associate Professor, Department of Psychiatry at University Hospital. I am Nelson Ramirez, Executive Director at Hispanic UMADAOP. If you or a loved one is battling with alcohol or drug abuse and addiction, please call our bilingual intake department at 216-777-3045 or visit us at casaalma.org. That's Casa Alma, CASAALMA.org. I thank you for watching our broadcast.